So obviously we have the apex of the heart down here. The base of the heart is going to be up here. This is going to be the right side. This is going to be the left side. So we have left ventricle, we have left auricle or left atrium, we have the right ventricle, the right ventricle, and then the right auricle on the right side. Our interventricular septum runs down the center. This is where our left coronary sinus is going to run. So this is where the artery taking blood to the left ventricle runs. The right coronary sinus is covered in fat. So the right coronary sinus is going to run right underneath the right atrium, or run in between the right atrium and the right ventricle. Some external structures that you should be aware of. This is the pulmonary artery coming here. So this is coming out of the right ventricle, taking deoxygenated blood from the heart. It's going to come out here, dump into both lungs. This large structure here is the aorta. Big thing to notice, we have an artery here. Notice how thick the wall of that artery is. We'll look at some vasculature and you'll see the difference between the thickness there. So that is aorta. This is pulmonary artery coming out. If we flip the heart, now we're looking at the back side of the heart. These two openings here, this is the caudal vena cava. So this is bringing blood back from everything below the diaphragm up to the heart. Look at how thin, because this is a vein, look at how thin the wall of the vein is in comparison to the wall of this artery. So we have caudal vena cava. Up in front here, we have the cranial vena cava. Both of these are dumping into the right atrium. Okay, this is bringing blood from the head and the neck and the front limbs back to the heart. This is bringing blood from the diaphragm and everything caudally back to the heart. The other structures back here we need to be aware of. One of them is right here. One of them is over here. These are the pulmonary veins. And again, if we look at the thickness, very, very thin. This is bringing oxygenated blood from the lung. So this is coming from the left lung. This one's coming from the right lung, and they're both depositing into the left atrium prior to going into the ventricle. Okay, so those are external structures that we need to be aware of. Looking at internal structures, didn't cut that very well. Not me. I don't make mistakes.
You're perfect.
Thanks. I appreciate that. All right, so you didn't get a very good cut. Do a little. fatty heart here. So what are the 4 valves of the heart? Tricuspid separates what? The right atrium and the right ventricle. Then we have the mitral valve. And the mitral valve is going to separate the left atrium and the left ventricle. Then we have the aortic valve, and that is the left ventricle and the aorta. The 4th valve, the pulmonary, is going to separate the right ventricle and the pulmonary artery. The good thing is that I have really good hearing. This Paisley may be going to talk a little quieter. Glad you did. Inside the heart. So the first thing we identify is that this is the left side. This is going to be the left ventricle, and we know it's the left ventricle strictly based on the external wall of the heart. So if we look at the thickness here compared to the thickness of this ventricle over here, we can see we have a significant thickness difference, making this the right ventricle, which makes sense because we don't have to go very far. We're literally going from the heart to the lungs that are sitting right here, as comparison to the left ventricle that has to take blood from here and push it all the way to the nose, the toes, and the tip of the tail. As we look at internal structures, we can see these little strings here, and these little strings are attached to the valve themselves. These strings are the chordae tendineae. That is what allows the valve flap to move with each compression. So atrial compression, the blood flows down. As the ventricle compresses, that forces these valves closed, and it opens up these valves. So this is the left side that we're looking at. So this would be the mitral valve with the chordae tendineae. The chordae tendineae are then attached to these thick bundles of muscle within the heart wall itself. Those are the papillary muscles. So the papillary muscle attaches to the chordae tendineae, which then attaches to the valve itself. So mitral valve coming up into the aorta, we can see that the aortic valve is similar. It is a 3-leaflet valve. We do have some chordae tendineae-like structures, but they're not as string-like we're used to seeing with the mitral and tricuspid valve. So the tricuspid valve in the right side is going to look identical to what we see on the left-hand side. So this is right side of the heart. And we can tell it's the right side because our overall thickness is very, very minimal. We've taken out a section so that we can see the actual valve. Notice that the chordae tendineae are a lot smaller on the right-hand side than what we had on the left-hand side, which makes sense because the pressures on this side are going to be a lot less than what we have on the left-hand side. So chordae tendineae, mitral valve, aortic valve, then we have the tricuspid valve on the right-hand side, and let's find our pulmonic valve, which is going to be over here. So we actually have 3 of the 4 valves on this one here. So tricuspid, aortic, and then pulmonic. So again, very thin, leaf-like structures to make up that pulmonic valve. The other thing that you'll see, and I'm not going to open up this left side anymore because it actually looks really good, but you can see it up here in the atrium on the right-hand side. All of these divots and depressions and grooves, those are all trabeculae carnae. So all of these depressions in here, that allows for the blood to come in and have a storage space or an area to sit prior to that atrium contracting and pushing the blood down into the ventricle. So trabeculae carnae, the chordae tendineae, the papillary muscle, and the valves of the heart, being able to identify right side versus left side, and then the external structures being atriums and then the valve or the vessels on the external side, aorta being this large one here, pulmonic coming out of the right hand side. So those are the structures of the heart that we need to be aware of.